Hi guys, it's Sheena from Teton Raptor Center and I'm here to give you all this week's patient update. Right now we still have so many patients in our care, so unfortunately this video can't cover every single patient, but if there is a bird that you're interested in learning more about, please feel free to text us at the number below in the description and you can ask and inquire about that specific bird. All right, let's go ahead and get started. I want to kick things off by highlighting our most recent release. This is American Kestrel 818 going back out into the wild after the bird came in due to a blood parasite infection. Our second release of the week is Great Horned Owl 629A. This bird came from Victor, Idaho due to a left coracoid fracture and some left eye trauma. Moving right along to our current patients, here we have Sharp-shinned Hawk 97. This bird came from Jackson, Wyoming after he unfortunately flew into a window. He's dealing with some head trauma and some eye trauma, and right now we're treating him with medicated eye drops several times a day, as well as anti-inflammatories, and currently he's living in our ICU and is on supplemental oxygen. Next up, we've got Osprey 830. This bird came in from Swan Valley, Idaho due to a luxation in his halix. So essentially that just means that this bird dislocated one of his toes. You can see in the picture right here, he's got a blue wrap on his foot, and that wrap will stay on for 2 weeks total to keep that toe in place to allow it to heal. And then after 2 weeks, he'll get 2 more weeks of cage rest, but without the wrap, just because we want to make sure that toe doesn't dislocate again. Next up is Swainson's Hawk 822B. This bird came in from Ammon, Idaho after it was attacked by a pet dog. So this juvenile ended up dealing with a fractured left ulna as a result, and right now we are able to treat this left ulna without any surgical intervention just because the bone has been broken in almost the most perfect way possible if you're going to be breaking your ulna. So thankfully we don't need to surgically intervene, but this bird will need about 5 weeks of total cage rest before we can take that wrap off and begin any flight conditioning. Next up is Swainson's Hawk 822A. This bird came in from Island Park, Idaho due to a blood parasite infection, and here he is moving out to the flight barn for the first time. We actually have 5 other hawks out there at the moment, so he is one of 6, and here he is flying out there for the first time. Next up, we've got Swainson's Hawk 812B. This bird came in from Ammon, Idaho after it was unfortunately shot. Reminder, shooting raptors is not legal, and that unfortunately left the left ulna and the left metacarpus to be fractured, as well as soft tissue damage to the left wing. Luckily, this bird is doing pretty well so far. We've had him for about a month, and he is now no longer living with a wrap on. We're doing extensive physical therapy, cold laser therapy, and he's working on just kind of stretching and getting that wing moving again and beginning his flight conditioning. Last but not least this week is Swainson's Hawk 727. This is now one of our most interesting cases. This bird came in because he was hit by a car and suffered a broken left scapula and a broken right coracoid. We moved him along in his journey and put him out in the flight barn and actually noticed that there was something wrong with his left femur. So we took new x-rays and noticed that there was a very, very small fracture in the left femur that we pretty much didn't notice when we first admitted this bird, just because the fracture was so teeny tiny. Unfortunately, the fracture was really close to the hip joint, and so we actually did our first FHO procedure on this bird. That stands for femoral head ostectomy. Typically, that's a procedure that can be done commonly in cats and dogs that are under about 30 pounds, and obviously raptors, there's really no raptor that's going to be more than 30 pounds. This guy probably weighs about 1.5 pounds at max, and so we did this procedure and we're having really great success so far. He's standing on both legs, but essentially we lop off the very proximal region of the femur, so the very top of the femur that is connected to the hip joint, and that allows it to heal and kind of fuse back in place with the acetabulum or the hip joint itself, which is pretty cool. We've never done this before. All right, that's all we've got for this week. Thank you guys so much for tuning in, and I hope you enjoyed learning more about our birds. Remember that if you want to do your part to help keep wild birds wild, you can check out our website at tetonraptorcenter.org and make a donation. You can also click the link in the description below, and that will take you right to our donate page. Bye!